So today we will read a topic acute inflammation. So first of all, what is inflammation? Inflammation, it is a defense mechanism of a body against a tissue injury to limit the spread of the injury. It is of two types, acute and chronic. So acute inflammation, it is inflammation which is less than of 2 weeks. Duration is less than 2 weeks, and chronic inflammation is more than 2 weeks. It is the first difference. There is so much difference, but I am telling only one to you. After in main topic we will read about the difference, all the difference between this. So what is a inflammation? Inflammation is a local response of living vascularized tissue to an injury. It is a body defense mechanism in order to eliminate or limit the spread of injury. So there are some signs of inflammations. On the basis of that, we can say that it is a acute inflammation. Okay, so signs are redness. So wherever the injury, there we can see there is a redness, or there is a local heat, rise in the local heat, and there is a swelling at that site, and also pain. If these four things you see, then you can say that it is a inflammation. Okay, so redness, heat, swelling, pain, it is a normal words, but in medical terms, redness is duber. So redness is occurs due to increase in blood flow and blood stasis. Increase in blood flow at the site, and stasis means blood flow is slow. Okay. Then there is a heat. Heat is occurs due to increase in blood flow. Swelling at the site, it is occurs due to increased vascular permeability. Pain, the pain at that site, it is occurs due to chemical mediators like prostaglandins and kinase. Okay, so these things is a signs of inflammation. So I also tell you why this happens, what is the reason behind redness, heat, swelling, and pain. So next we will go towards the causes of acute inflammation. So main cause is there is infection or microbial toxin, tissue necrosis, foreign body or immunization reaction. So infection and microbial toxin, you all know that if there is infections at that site, okay, then there is a signs of acute inflammation. Tissue necrosis means there is a removal of the dead tissue. So why dead tissue happens, why dead tissue occurs at that site? Due to ischemia is decrease in blood supply at that site due to blockage of the blood vessels. Okay, or physical agents, thermal, radiation, electric shock. Due to physical agent, there is a tissue necrosis, or there is a chemical injury due to which there is a tissue necrosis. If any foreign body or immunization reaction like hypersensitivity reaction, say autoimmune disease, due to which there is a inflammation. So this is the causes of inflammation. Then we will move towards the events of acute inflammations. There is a two events. First is vascular events, second is a cellular events. In vascular events, there is a hemodynamic change and altered vascular permeability. And in cellular events, there is a exudation and phagocytosis. In exudations, there is a change in blood flow, rolling and adhesions, transmigration, chemotaxis. And phagocytosis, recognition and attachment, engulfment, killing and degradation. Acute inflammation is of short duration, less than 2 weeks, and represents early body reactions resolve quickly. Main features: accumulation of fluid and plasma at the site, intravascular activations of platelets, polymorphonuclear neutrophils as inflammatory cells. So first we will read broadly in vascular events. In vascular events, there is a alternation of microvascular is earliest response to tissue injury. Okay, then there is a hemodynamic change. In hemodynamic change, there is a vasodilation, earliest features, increased blood flow, local heat and redness. Chemical mediators, histamine, kinin, prostaglandins, platelets, activating factors. Increased permeability of microvasculature. In increased permeability, then second event, there is increased permeability of microvasculature. In this, there is a translocation of these fluids into extravascular space responsible for swelling at the site. Histamine and leukotrienes, PEF and kinin are responsible for this slowing of blood flow. Increased concentration of RBC in vessels, increased viscosity of blood, stasis, then there is stasis of blood. due to which there is a local redness, leukocytic migrations, triple response. First there is a red line within few seconds, then flare, then wheel. Red line within few seconds, flare, bright reddish appearance around red line, wheel, swelling of surrounding skin. Then there is a altered vascular permeability. In this there is a contractions of endothelial cells. Most common vessels is venules immediately after injuries. Histamines and bradykinin short lives. Direct endothelial injury, bacterial infection, radiation injury, immediate sustained or delayed prolongation. Arterioles, venules, and capillaries are the most common sites. Cell necrosis and detachment. Then there is a leukocyte-mediated vascular injury. In these examples is pulmonary venules and capillaries. Leukocyte which adheres to endothelium during inflammations may themselves injuries. Okay, delayed and prolonged. Examples is venules and capillaries. In this there is a leukocyte activation and reaction oxygen species. Transcytosis process of transports of fluids and proteins through channels called vesicular are increased in number. Neovascularization. Example है healing and tumor. During repair, new blood vessels are formed, thus they leaky till matures. So there is a difference between transudate and exudate. Transudate cause is non-inflammatory. Exudate it is inflammatory process. Mechanism of transudate is ultrafiltration of plasma with normal vascular permeability. In exudate there is increased vascular permeability. Appearance of transudate is clear and serous. Appearance of exudate is cloudy, purulent. Color of transudate is straw and yellow in color, and exudate it is red to yellow in color. Type of cells: few lymphocytes and mesothelial cells. And in exudate there is a neutrophils and lymphocytes. Character of edema: in transudate it is a pitting type, and in exudate it is non-pitting type. Clot in exudate absent in transudate. In transudate absent and exudate present. Cell count in transudate low, exudate high. Okay, these are the events. Then there is a cellular events. This process delivers lymphocytes capable of phagocytosis to site of injury. Exudations of leukocytes. Mechanism: change in flow of blood. When blood flow slows down, leukocytes move towards the peripheral columns and accumulates along the endothelial surface of vessels, called margination. Then there is a rolling. In rolling there is a marginal leukocyte attach weakly to endothelium, detach and bind again with mild jumping movement. It causes rolling of leukocyte along endothelial surface. Molecule involves selecting family of adhesive molecules. Chemical mediators are cytokines and chemokines. Tumor necrosis factors like TNF and interleukin-1. Adhesions: endothelial gets activated and leukocytes bind more firmly. Molecule involves integrins, chemical TNF, interleukin-1, chemokines also. Then there is transmigrations. Leukocyte migrates through vessel walls by squeezing through intercellular junctions between endotheliums. They penetrate basement membranes of vessels by secreting collagenase. Molecules involved in membranes of immunoglobulin superfamily called PECAM1 or CD31. Then there is a chemotaxis, process of migration of leukocytes towards inflammatory stimulation in direction of gradient locally produced by chemoattractants. So it is of two types: endogenous or exogenous. Endogenous means within the body, exogenous from outside the body is like bacterial products like formulated peptides. Endogenous means cytokines, interleukin 8, complement components like C5a, C3a, leukotrienes B4. Okay, these are the chemotaxis, chemoattractants. ठीक है. Mechanism of mechanisms of chemotaxis. Chemoattractants bind to GPCR present on leukocytes. GPCR sends signals for activation of effector molecules on neutrophils. Effector molecules act as a membrane phospholipids and increase cytosolic calcium, result in cytoskeletal change. Polymerization of actins at front end and myosin at back end of cell, resulting in forward movement of leukocytes towards chemoattractants. Then moment there is a phagocytosis, process of cellular engulfment of solid particulates material, polymorphonuclear neutrophils and macrophages. Recognition and attachment, initiated by expression of cell surface receptors recognized by microorganisms. Enhanced when microorganisms are coated by opsins from serum called opsonizations. So opsins are IgG, collectins and C3b. Engulfments by formation of cytoplasmic pseudopods around particles due to activations of actin filaments, thus developing phagocytic vacuoles. Phagosome. Phagosome fuses with one or more lysosomes of cell and form bigger vacuoles called phagolysosome. Killing and degradations of microbes to glimpse of it intracellular and extracellular. Intracellular, the species which are helps in killing and degradations are reactive oxygen species, nitric oxide, lysosomal granules, extracellular activated leukocytes and immune mechanism. So this is the diagram. It will help you. And okay, so this all about this topic. Okay, if you didn't understand, you can comment below. So I will give lectures again on this. Okay, thank you.